Welcome to my viewers. I am Professor Durga Prasad Das, Head of the Department of Kamar Vritya, Sri Sri College of Ayurvedic Science and Research Hospital, Sri Sri University, Cuttack. Let me to discuss about my department and the facilities available in my department for your knowledge. This is one big or better college in Odisha state where all facilities are available in concern with the treatment. Second is education, third is the rehabilitation management, and fourth is the curative management. So in this way, let me to discuss about the department and the facilities. Our department, we have professor, associate professor, assistant professor. So now we will focus on the treatment aspects for the benefit of the people of my state Odisha as well as from all over India. So as treatment is concerned, we have unique treatments available here. So one is the predictive medicine. Predictive means we have to think, we have to imagine after looking the constituent of the child. So exactly the body is Vatic body build or Poitic body build or Kaphaj body build. This is as per Ayurvedic concepts. So from the body build, we have to imagine what might be the future problem the child will be suffering from, or what is the recent problem the child is having, and how to prevent these conditions and how to cure the ailment. Preventive is much more important because prevention is better than cure. So in preventive aspect, we are giving emphasis to administration of the preventive medicines. Like allopathy, the preventives are some of the vaccinations. At birth, OPV, then BCG, then hepatitis B, then multiple things are administered up to 5 years and up to 16 years. In Ayurveda science, we are giving emphasis on administration of antioxidants like Chyawanprash, then Brahgi, Haritaki, and many medicines are there, like Brahma Rasayan also we can administer. So these Rasayan will be acting as Rasayan medicine, that is antioxidant actions, which helps for the children's nourishment and growth and development. Similarly, Swarnaprasan is popularized in India recently, and it also gets maximum acceptance by the parents because Suvaranang Madhusarpisham is mentioned in Ayurvedic text, which helps a lot for the prevention of multiple diseases due to its immunomodulation action. Three things are administered. One is Swarnabhasma, another is honey, and third one is Brahmi Vruta. We have to prepare a mixture on the day of Pushya Nakshatra. As per Hindu rites, so every month one day will be coming, that is Pushya Nakshatra day, and on that day, as per the classical reference and the advice, we are administering Swarnaprasan to all children of age birth to 16 years of age with admissible doses. And in practical observation, since last 5 years of our experience in this institution, we have seen those children who are taking Swarnaprasan regularly, they are prevented from multiple types of upper respiratory infections and chronic infections. Even their appetite is now normal. They are not exposed to cold or respiratory sensitive viral infections. They are now not suffering from chronic fever. Many things are prevented. Simultaneously, it helps for the increase of their intellect promoting action. Now, they could able to perceive properly and they could able to recognize, even in the diseased individuals also, we are administering Swarnaprasan. It helps a lot and it particularly prevents multiple diseases. As you know, now because of multiple neurobiological problems due to exposure of the screen of mobile, child are suffering from multiple diseases, autism, attention deficit hyperactive disorder, behavioral problems are now very common. Childs are now irritable because they are giving emphasis on mobile phones. The parents, because of ignorance, they are giving the mobile phone during eatings, which causes obesity. Again, exposure to TV also, that will be another one cause of obesity. Then the child having some irritable, imbalanced psych structure, because in mobile games they are involved themselves, and now the patients who are getting in the OPD are gaming disorders due to overuse of mobile phones. So that causes imbalance between the neurotransmitters, like serotonin, dopamine, they are the neurotransmitters, and because of over irritations they are suffering a lot, and neither they are giving concentration on their fooding, on their daily routine activities, on their schooling, their dressing. They are out of study or they avoid study, and they are giving much more emphasis on the mobile games. So through Ayurvedic treatment and through Ayurvedic medicines and through personalized care, those can be prevented properly. Abhyanga therapy is one best therapy for the children. If one child will be taking massage therapy or Abhyanga for a long duration, then multiple skin diseases will be prevented, and child exposure towards respiratory syncytial virus will be prevented, because that may not cause any disturbances for the child. And another treatment is Sali Sastika Pindasweda. Particularly one Shali Dhanya is available, and we are preparing its rice and rice coils, and using that we are giving massage over the body. And Sali Sastika Pindasweda massage helps a lot for stimulating the neurological function of the child, and child gets nourishment. Simultaneously, the imbalanced nervous system will be balanced. So all the neurobiological problems, we are administering Basti therapy, Abhyanga therapy, Salisastika Pindasweda, as well as Nasya therapy, which is available in our Sri Sri Ayurveda hospital, and it helps a lot. Regularly 10 to 15 child from morning to evening, they are taking treatments as per their schedule. And when we are giving emphasis on the personalized treatment, particularly the curative aspects, so we have many medicines available in the Ayurvedic tests, starting from Kastosadi to Rasosadi, from syrup to Asam and Arista. As per the disease condition, we are focusing on that, and we are administering the Ayurvedic treatments which is quite safest. And Ayurvedic medicines along with Panchakarma again accelerates the treatment protocol, and the benefits are very, very more. When a child will be taking treatment from any allopathy hospitals, though the treatment is good, but overuse of antibiotics, or some of the child they are coming, sir, every month for 5 to 7 days my child is taking antibiotics because of chronic respiratory infections or elemental tract infections. In that condition, if they will come and they will take Ayurvedic treatments, definitely they will be getting better actions. Ayurvedic pediatricians always giving focus on treatments with preventive actions, with personalized care, with behavioral aspects, with the nutrition or dietary aspects. So in that way, all the child will be getting much more benefit. In this way, we, the Kamarhutya department, giving much more focus for the prevention, curative aspects, and personalized management, as well as the rehabilitative care for all the children.